I am feeling okay. Welcome to the Stream Home Edition. Over the past few weeks, we have been looking at how different countries around the world have tackled COVID-19. A lot of similar strategies, staying away from each other, washing hands, of course, shutting down schools, lockdown. But in Sweden, they have a very different approach, and that is what we're going to be looking at during today's program. Now, we're going to start with Zach Alfred. Zach was a former streamer. He used to work on the stream, but he now lives in Stockholm and he's a Swedish resident. So we gave him an assignment. We asked him, Zach, what is it like to be in Sweden right now with the coronavirus pandemic? Hi there, Zach.
Greetings from Stockholm, Sweden, where life is not under lockdown. I'm currently at a park which is bustling with families and kids out on a Sunday afternoon. Though while we're not under lockdown, it's not really true that life is proceeding as normal. For example, since the middle of March, I've been working from home, and I think that most people are probably taking this seriously. That's been my experience, though with exceptions. For example, my neighbors last weekend decided it would be appropriate to have a multi-generational birthday party where there were little kids and grandparents as well. You know, while I appreciate my liberty and my freedom to move, I wonder if maybe we're not making the sacrifices that we needed to make to save lives. And certainly from the numbers, if you compare Sweden with other countries in Northern Europe, we are doing much worse. Is this a good long-term strategy? I'm not sure.
And he lives in Sweden. I know that you have questions as well, and the way to share them and your concerns is to jump into our YouTube chat right now, and you can be part of the stream. Let's meet our guests. Hello, Nivette. Tell the audience who you are.
Hi, I'm Nivette Dawood, and I'm a reporter at the Swedish newspaper Aftonbladet, and I've been live reporting about the coronavirus in the whole world and in Sweden for millions of readers, and been answering their questions as well.
All right, we look forward to tapping into your expertise. Hello, Helen. Introduce yourself.
Hi, I'm Helen Lindberg. Thank you for having me. I'm a professor of political science at Uppsala University in Sweden. I'm following this from a political and ethical perspective mostly.
Mm-hmm. Good to have you. And Dr. Emma, we can't have a conversation without an epidemiologist, and you are our epidemiologist. Introduce yourself.
I'm Emma Frans. I'm a doctor in epidemiology working at Karolinska Institutet in Stockholm. And I'm also a science writer, so I also try to explain to people what's going on in Sweden and other parts of the world during this corona pandemic.
Very good. Good to have you all, ladies. I'm going to start with a tweet here from our online community. When we told them we were looking at Sweden, this is one of the responses that we got. It is better than many locked up countries, the idea being that Sweden isn't locked up. Yvette, we heard from Zach a little bit earlier. You said it's not exactly a free-for-all, but there certainly seems to be a lot of freedom. If you could explain what life is like today in Sweden, how would you explain it? What's open, what's closed?
Well, as you said, we haven't adopted a strict lockdown, but as mentioned before, life isn't really as it usually is. We do have recommendations and some regulations as well. We're not allowed to meet more than 50 persons at the same time. And there is a ban, for example, on visiting nursing homes with the elderly. And to sum it up, these recommendations and rules are, of course, the government's and the public health agencies' way of battling the coronavirus, and the goal is the same as in other countries as well. But yes, we haven't adopted a strict lockdown as many other countries.
I could see out the corner of my eye. Dr. Emma made a note. Share that note with the world, Dr. Emma. What did you write down?
No, but I agree. I think it's very important for people around the world to understand that there are some restrictions in Sweden, because now people in other countries are starting to talk about lifting some restrictions. So I think it's important to understand that the measures taken in Sweden are the goal of them is to get physical distancing between people and to protect the elderly, to flatten the curve. So this is quite close to what other countries are trying to achieve, but we might be trying to achieve it in a different way by recommendations instead of harsher measurements and legal restrictions.
Why? Why are you doing it different from huge swathes of the rest of Europe and the world?
Yeah. I think there are some political and legal reasons for this. It's not very easy to restrict the freedom of people here in Sweden. We also have a history of high trust in the authorities. We have other examples, for instance, when it comes to other parts of Europe, there are people who are very resistant to vaccinating their children. People are skeptical towards, for instance, vaccinating against measles. In Sweden, we have non-compulsory vaccination, but still there are 7% of all children are fully vaccinated. So we have this kind of culture in trusting the authorities and following their recommendations. So I think that's part of the reason. However, this is, of course, a very special situation, and nobody really knows which measurements work the best. So, it's new ground for everyone. So it's difficult at this point to see whether these recommendations are enough or not.
And let me bring you into the conversation. There's something that I noted. It was a whole Twitter thread that was under our shows explaining what we were going to be talking about today, talking about Sweden and the coronavirus. And Ali Lindo says, it's important to note the Swedish government legally couldn't impose a lockdown as seen in other countries. But then the debate goes on, that's false. We have a paragraph in the constitution. And then Nick says, this is an important part of the Swedish discussion, often gets left out. So is it a legal thing that you cannot have a lockdown, or is it more of a cultural thing that actually Swedish people don't need a lockdown? They're very sensible.
Well, there has
I
been...
would say...
Oh, sorry.
Helen goes first, and then Nivette, you follow up. Helen, you start.
Oh, yeah. Okay.
Yeah.
Sure.
Yeah, sure. I would say it's a combination of both culture and a favored interpretation of the constitution. Yeah, I can stop there. But Nivette wanted to say something. Sorry.
Yeah, Nivette,
I
go
just
ahead.
wanted to add that there has been some law changes in case the government sees it fit to close down schools, for example. And we're reminded all the time that if they feel that it's necessary, there might be more restrictions, as closing down schools, for example. And there has been some changes, for example, that high school students and university students aren't allowed to. Oh, sorry. Their education is now on distance, and they're doing a lot of digital
remote learning,
and aren't visiting the universities and schools.
All right, ladies, lots and lots of comments in the YouTube comments section. Dr. Emma, I'm putting this one to you. Navid says, stop romanticizing Sweden's approach. I live here and I have heard from healthcare workers about the lack of resources and safety measures in hospitals. Dr. Emma, respond. Have you heard of lack of equipment?
I think it's, nobody really knows if our strategy is best. So I think we have to be humble about that. And I'm not trying to romanticize the Swedish approach. And we definitely see clearly that we have higher death rates compared to our neighboring countries, and we have definitely failed in Sweden in protecting the elderly. So the strategy in Sweden has been to flatten the curve, to make sure that the people needing health is within the capacity of the healthcare system, but also protecting the elderly. And unfortunately, we have not been able to do that. So much of the high death rates in Sweden is explained by this virus actually getting into nursing homes. So this has been a big issue here in Sweden.
In fact, that's such a good point, that the homes for the elderly have been really hit by COVID-19. Can you give us an idea of how badly they've been hit?
So every day we have a press conference with the Public Health Agency, and they update us about the newly infected numbers and the new deaths. And during these press conferences, they also repeatedly say that this is a failure, that many nursing homes actually have the virus in their homes, and that many of the deaths are people who are over 70. And all the recommendations are very thorough when it comes to people over 70. And like I said before, I think the most strict ban that we have gotten during this pandemic is the visiting of nursing homes. That is actually forbidden, which is one of the few things actually that is forbidden now in Sweden.
Sure. I want to bring in this headline here. It's a headline that we had on Al Jazeera quite recently. Sweden ambassador says that Stockholm could reach herd immunity by May. Helen, I'm just wondering, as somebody who is living in Sweden right now, how have the scientists been explaining herd immunity to you, or are they even avoiding that phrase?
Oh, this is a huge question right now in Sweden. And yes, I would say from my point of view that they have avoided using the term herd immunity. In fact, our chief epidemiologist, he also said that he wanted to avoid the term because he said that would imply that we give up against this virus. So at one point he actually said that they are not using that term, and also consistently not using that term. But if you look at the actions and the consequences of their actions, the transmission is allowed. And they have also claimed that they want to have a certain degree of transmission to achieve, or as they say, the side effect will be a kind of herd immunity. And the figures I've seen and that they floated has been just like this, like 25 or 30% in May. And that is clearly not going to happen as it looks now from the serology tests we have right now.
Let me just dip into, thank you, Helen. Let me just dip into YouTube. Lots of conversation happening on YouTube. Sandra Laxmi, restrictions are a farce. 50 people gathering. Buses and trams are crammed. I live here and my partner has to go to work every day. So this idea of what Sweden is doing, Dr. Rama, can you explain, if it's not herd immunity, what is it? And the idea that 50 people can get together, why wouldn't they pass on COVID-19 to each other?
Yeah, well, everybody's asked to restrict their number of social contacts. So even if this ban is not under 50 people, people are still told to limit their social contacts, and the elderly people above 70 years old are told to limit all of their social contacts, basically, and not to meet grandchildren. So I think it's kind of a misconception that the Swedes are doing it very much differently compared to countries, but we are trying to flatten the curve and protect the elderly. But I think a difference, as you heard previously, is that you're actually not trying to stop the virus from spreading, but merely slow down the process. So I think the viewpoint is that this is here and we are not going to be able to stop it. Instead, we're trying to slow down the spread of it so that the healthcare system will be able to manage it, and that the herd immunity is a side effect of this, and possibly a positive side effect, because this will in the long run mean that this virus will stop spreading in the population.
So I have to say that there are a group of scientists who vehemently disagree with the policy of the Swedish government right now. And they got together, they wrote an open editorial in a newspaper. One of those scientists is called Lena Einhorn, and this is why she thinks that this is a very bad strategy for Sweden right now. Let's have a listen, let's have a look.
Sweden is nowhere near herd immunity, and nor is Stockholm. We have intense clusters of infected people and people with antibodies, but in the general population, also within Stockholm, it's very low, a few percent only. And this is in spite of the fact that Sweden has very high death numbers compared to the other Scandinavian countries. In the last week that was measured, Sweden had 501 deaths, whereas Norway had 11 deaths. And this means that herd immunity is not at all a means to acquire any kind of solution to this epidemic.
Yes, I'm just wondering how popular an opinion that is. I want to share another one with you here on Twitter. This is Clovis R. Silver. Clovis suggested that we tackle this topic today. Thank you, Clovis. It is a fascinating conversation that we're having right now. And Clovis lives in Sweden. And he says two of the biggest challenges have been the spread of COVID-19 in elderly homes, which I know, Nivette, you've been looking at, and in some Stockholm areas. Lessons are being learned, as in all countries. Overall, it has been quite successfully done for a low-density country. Nivette, when you've been speaking to the public, do they think this is a good idea? Do they feel that this is a success?
Well, I think that you can say that many Swedes trust the government and they trust the agencies, and that they're trying to do their best to follow the recommendations and the regulations that we have. Many people that write to us at Aftonbladet are really worried and wonder if they're doing the right thing, if they're following the rules. Some of the rules are a bit hard to implement and to be sure that they're doing the right thing. A lot of people are also concerned that they have to go to work even though they are, for example, a high-risk group. So, of course, there are a lot of questions about this strategy since it's differing from many other countries, but I do think that a lot of Swedes just try to follow the rules and hope that they're doing the right thing. I think the politicians and the government,
trusting in the science, or your scientists, what your scientists are telling you.
I think that.
Go ahead, Nivette. Yes, Nivette.
Yeah, I think that no one is really sure about the right strategy, and the government and the agencies are saying this all the time, that we're not sure that we're doing the right thing, but this is what we believe in as a strategy. So I think that's good to keep in mind.
I think this is important, and I think it's important to add this to the conversation. Thank you, R.H. Olsen, who's on YouTube, adding this in. Homes for the elderly have been hit all over the world, whether the Swedish approach has a lockdown or doesn't have a lockdown. Good point. Thank you for that. And then I want to move on just a little bit, Dr. Emma, because we've got so many questions. It's really about, does this actually even work? So Zuckers8 on Twitter, Sweden is betting that the death toll will be high early on and low
the
later.
strategy? Oh, sorry.
Yeah, but with no negative effect on their economy. I guess time will tell. Are you gambling with some people's lives? Dr. Emma, is there a gamble that's going on? Is there an equation? Is there an equation where if
I think
so
we
many
all
people die,
are,
then you have to
or
shut up?
not that we're
All right, as you can hear, we have a difficulty with our connection.
well. I
Dr.
don't
Emma,
think
sorry,
the
I know you're trying.
healthcare.
I know you're trying to reply to me. Try one more time. Are you gambling with people's lives in Sweden?
Yes. I think that whatever a country is doing right now, there will be economic costs. There will also be people dying. And I think it's very important also to look at the longer perspective. As you've heard previously, we can see higher death rates in Sweden as compared to our neighboring countries. But some people argue that these countries who have had stricter measures, they are merely postponing this epidemic. So it's very important to consider the health effects in the long run, not only the economic costs. So what we see in countries where we have had lockdowns, we've seen increase in domestic violence. We have seen some countries canceling their vaccination programs for children. So will be side effects of these stricter measures. So I think it's very important to remember this, that even though we could reduce the rates in short term, nobody really knows what will be the best strategy in the long run, not only when it comes to the financial, the economy, but also when it comes to the public health issues.
Right. I want to go to Helen, because when you look at who's dying, it's elderly people, but also immigrants are quite high on the list of people who are dying. Is that telling me something about society in Sweden, about who Sweden is okay about letting die? Was that a little harsh?
Thank you for bringing up that question, because when we talk about who are the hardest hit in Sweden right now, of course it's the elderly, and I have perhaps another complementing explanation to why the elderly are harder than other groups in Sweden right now. But if we talk about the minority groups in Sweden, we can just have as an example, I know on a private initiative in mid-March and late March, first at that time, the authorities were providing communication and information in different languages that could reach out to ethnic minorities. And we have a large group of ethnic minorities in Sweden. And the discourse, if we could say, the overall talk from the authorities in the beginning was that Swedes, as they called it, they behave in a certain kind of way. And I've heard it too in this show from my co-participants, that they rely on Swedes to act in a certain kind of way, follow the rules, be respecting the authorities. And yes, sure, but we also have groups in Sweden that spend time with each other in their everyday lives in perhaps a different way than the authorities counted on.
So Helen, I'm just going to push you. I'm going to push you because we're right at the end of the show. Do you like what's going on in Sweden right now because of COVID-19? Do you like it? Is it working?
I don't like it, and I don't think it's working. And the measure I have on that is our staggering amount of deaths and the excess deaths. So consider that fact, it's not working, I would say.
Okay. All right. This is a conversation because even Sweden doesn't know, will this work yet? And they will, if they need to, change direction if they feel they need to. So it is all a giant experiment that all of us all over the world are trying to participate in and hopefully have good outcomes. This show was suggested by one of our viewers, one of our online community. Let me show you how you do that. We do that back here. Is there a story or issue you think we should cover? You look down here, you'll see that Clovis has suggested on April the 20th that we do this very show. Thank you, Clovis R. Silver. We have looked at the Swedish response to the pandemic. Thank you, Nivette, Helen, and Dr. Emma as well. Of course, this debate, this discussion about Sweden will continue. But for now, thanks for watching, everybody. Thank you, YouTube. See you next time.